What is breast reduction?
Breast reduction is a procedure to reduce the size of the breast. Sometimes a person, a woman, may have a very large breast from an early age, even in their teenage years. At other times, the size of the breast might become larger as a result of pregnancy or hormonal changes in the body. When the breast gets large, the person may have problems with their back. They may have back pain. They may have shoulder pain. They may develop bands due to the heavy size of the breast pulling down on their bra line and causing indentations in their shoulder. These problems can be unrelenting, and they can really cause a major problem for the person in the long run. A breast reduction is an operation designed to reduce the size of the breast so the person can be more comfortable. They can diminish the likelihood of future back problems. And at the same time, a breast reduction will also enhance the shape of the breast. It will make the breast look better as well.
And who is a good candidate for this procedure?
A good candidate for this procedure would be a person who is in good health, number one. A person who's got large breasts that they cannot reduce with just normal weight loss. Sometimes a person may have large breasts because they have been overweight. And sometimes it is possible to reduce the size of your breast with dieting and exercising. But for many individuals, it's not very possible to do that because of the fact that the large breast itself prevents them from exercising. And in others, diet does not work, and they still have the large breast problem. So a good candidate for a breast reduction would be an individual who's got large breasts and who's got back problems due to her large breast, and wishes to have a reduced size in order to be able to get back to her normal exercise routine and have less likelihood of future back problems and shoulder problems.
How is a breast reduction done?
There are many different techniques for reducing the size of the breast. A simple thing to do, for example, could be just pure liposuction. But for the most part, the most common methods for breast reduction are through surgery. The surgery for breast reduction can be done through a traditional technique of an anchor incision, meaning that you would take the breast, make an incision around the nipple, underneath the nipple, and across the bottom part of the breast, and take most of the breast tissue from that location. Modern techniques have been developed, newer techniques have been developed in which we are trying to limit the size of the scar, and these are called short scar breast reduction techniques. There are many different types of short scar breast reduction techniques, including ones that are, for example, only around the nipple, in which you make an incision and you just are able to reduce the size of the breast or lift the breast through the nipple. But by and large, the short scar techniques involve an incision around the nipple and underneath the breast, and then the breast itself is reduced by taking out tissue from underneath the breast in that area, trying to preserve the viability or the blood flow going to the nipple, because that's very important in keeping the nipple alive.
How long is the recovery for breast reduction?
The recovery for breast reduction is about 1 week as well.
And if someone's seeking to get breast reduction, what are the factors that they should look out for?
I think the first thing is to make sure that you're in good health to undergo an operation. Most individuals who have breast reduction are younger and therefore do not have any ongoing medical problems, and therefore they're good candidates. The other thing to see or look out for is to see if your breast reduction is causing back problems or shoulder problems. If these cases, if these things are being produced by the large size of the breast, then you're a good candidate to have this operation done.
And then after someone has the operation, how long before they can get back to their normal routine?
With breast reduction, the normal time period where they can get back into their normal routine in terms of work is about 1 week. With certain larger breast reductions, it could be a slightly longer period of recovery. Almost 95% of patients are back into their normal exercise routine and their daily activities after 3 to 4 weeks.
And if someone really wants to get breast reduction, what should they do? How should they go?
I think the first step in taking action towards doing a breast reduction is to see a well-qualified plastic surgeon. When a plastic surgeon examines you, they can tell you what type of breast reduction surgery you need, whether it can be done through a smaller procedure, right, like a short scar breast reduction, liposuction, or other techniques that are less invasive than the normal traditional breast reduction technique. In today's environment, I think many plastic surgeons are doing short breast reduction procedures, meaning short incisions for doing the breast reduction. And again, you have to do your research and see a well-qualified plastic surgeon before you make that decision. But that would be the first thing that you should do, is to see a well-qualified plastic surgeon for this procedure.